Quality. This is being driven tremendously by employers and our federal government. They're creating indicators, okay? Measurements. How many of you right now know how to measure quality healthcare? Raise your hand. Somebody's got to know it. My theory is if you don't die, that's quality care. If I go in there and I come back out, I have successfully used your practice. That's a good thing. That's a positive thing. But right now, it's a big struggle for everyone. We don't know how to measure quality, and employers have been frustrated with this, as well as the government. We're a volume system right now. The more I do, the better off I am. But in this situation, if you guys will look at this, it's a $20 copay for primary care, but for specialists, the moment you walk in the door, it's deductible. That's a game changer. You start thinking about it. Is this mole really cancerous? I don't know. Is it worth $150 to find out? That's a lot of money. $20? Yeah, I'll do it for $20. Maybe I'll save my moles up. I have 5 moles and 2 warts, $150. That's what people start thinking about though. If you look at the history of this company all started because 2 guys came together and said, if I could make an app for you, what would it be? And it was an OBGYN doctor, and the OBGYN doctor said, simply, I would love to be able to monitor 5 rooms at one time when I don't have to go all the rooms to look at the fetal monitoring. Cool. Built an app for it. Doctor could just stand there, watch the US Open while the babies were being delivered. So in the past, what we used to see was a paternalistic model of care. And what this basically means is you go to the doctor, they tell you what to do, and you do it. Now that has changed. You can do it in the office. How cool is that? I have a what? I don't think I have that. According to a doctor at Cleveland Clinic, I don't have that. In fact, I just sent him a text, and he tells me that if I could see him, I would probably be better off. Everybody seen the pancake mix where you just add water? All right. So when they first came out with the cake mix, they basically said just add water. Consumers didn't like it. Why not? Because they didn't feel engaged. Why not? Because when I'm making a cake, it is a special event in my life. I am having a birthday for my child. So therefore, I need to be engaged in the process. I can't just give my kid a cake that just has water in it. So what was the solution? Okay, add water and eggs. All of a sudden now, I'm baking. Now how cool is that? That's great. I'm engaged. Remember that facilitated model of care? Same thing. You want to be engaged.
As a CPA, one thing that I think we look for in this conference is the combination of healthcare information and also the business side of healthcare. So Cameron really did seem to have a good handle on both. He was very, very engaging, funny. I think it was really one of the best presentations of the conference. He definitely related it on a very personal level. That was, I think, one of the things that made it so much fun to watch the presentation, and he was really a great speaker.